health. And Paul, just a little bit about you. I'm so excited to have you here.
Yeah, I'm very excited to be here too. I before you get started, we've
Yeah,
only known each other like 2 or 3 weeks, right?
right.
But it feels like a lot longer than that. So I'm really looking forward to this. But go ahead. Sorry to interrupt.
No, I was just saying, Paul, if you could tell a little bit about your background. Today's,
Sure.
talk and his
Yeah.
little podcast is going to be for our patients. It's
Okay.
going to discuss, some of the tools you have in your book to help our patients get to the next level and the level they want.
Okay.
So,
Well, I'll
just,
tell you.
yeah.
Yeah, I'll just sort of ramble for a few minutes and we'll keep it brief. But I trained as a therapist, but I've spent most of my career in healthcare management and have worked up until a year ago today. It was my anniversary of my partial retirement from being the CEO of a nonprofit in New Hampshire,
Wow.
which serves people with developmental disabilities and intellectual disabilities and head injuries. And more recently, we started serving elderly people too, because the emphasis of all of our programs was to serve people in the community rather than in institutional settings. And so it's been a dream job. And I've been doing that for 25 years. And before that, I was working for another nonprofit that worked with people that had differing abilities. So I've been in this field for a long time, and and then I as you know, started writing books, motivational books, because I felt like I loved my work, but I felt like I had other things that I needed and wanted to do. So I started writing books, and that sort of launched a whole new sort of career for me. And then as I've aged and gotten older, I've had some physical limitations myself that I've had to deal with and come to terms with, some of them minor and some of them less minor, but certainly things that I can live with. And so, as old as I am, I'm very excited because I feel like I just continue to be presented with things that help take me to a deeper place of understanding myself and giving me more things to talk about with other people. So that's it. Oh, and I've got three wonderful kids and four grandkids that all live in Florida. So my partner and I spend part of the year in Florida so I can be close to my kids, and part of the year in New Hampshire so I can be close to the ocean. So that's my story in a nutshell.
That's wonderful. So, how did you get involved or interested in writing these books? Was there something that motivated you to?
Yeah, I think that I've always had this sense of wanting to encourage people or inspire people. And I think we're all born with sort of not a purpose, but many purposes. And I think one of the things that I was meant to do with my life was to encourage and motivate people. But to be honest with you, so much of that comes from what I write about is what I need to hear. And so I don't think of myself necessarily as an expert. I think of myself as a fellow traveler, but I get to talk about it with other people. And one of the things that's happened since I started writing my books, which was over 10 years ago, is that I have a Facebook community now that has over 2 million people from all over the world. And it's a very engaged community. So if people are interested and want to look for that, it's named after my first book, which is Begin with Yes. And so it's on Facebook. And if you want to just hear more about what I like to talk about, you can go there and find that as well. All of a sudden, your audio disappeared.
So when I first met you, I was really lucky, and I was blessed and excited because I said, "Wow, you could help impact so many of our patients struggling with day-to-day changes, with changes in their health, inability to walk, inability to do the things that they love." And the reason why I appreciated what you've done, is that there is so much to learn
Mhm.
after there is a disability. After somebody gets diagnosed with a rare disease or disabling
Mhm.
disease or genetic disease or anything that causes them not to be able to do the things they enjoy or love.
Right.
And even some of them have to be in wheelchairs, or, some of them have to wear braces. So there's a lot of changes that people have to go through. And I think that the book that you've written can help them get through those changes and change their mindset a little bit. So
Mhm.
that's what this discussion is going to be about. And I was just excited to have the opportunity to talk about this. So one of the things that we discussed, previously, before when we met uh, initially, was that we have patients that come in, they're in wheelchairs, right? They cannot move, they're not able to uh, you know, get around. And then socially, they're not able to meet people.
Mhm.
Really unfortunate. Like they can't, they have relationships get broken. They have to go back on the dating scene, or they have to, socialize. And yet they're scared, they're afraid, they're shy, they're anxious. There's a lot
Mhm.
of worry and doubt inside them. So I was wondering if there was something you'd help these kind of patients and say, look, Dr. Jerath, I'm not able to do the things I enjoy. Plus, I'm not able to socialize. I'm not able to,
Mhm.
I'll never meet anybody in my life. I'll never have friends. And so what are your thoughts about that? And what would you tell them?
I so many thoughts flow through my head when I listen to you present that, because life for everybody is a series of changes, right? You go from being young to being middle-aged if you're fortunate, and then you go from middle age to being older. And it's like life is sort of this very twist and turny kind of journey that we can't really predict. And so we're always whether it's situations like you've just described, people having those kinds of difficulties. But the reality is that everyone is going through changes that they have to adapt to, and that sense of needing to adapt is just a constant part of our lives, no matter who we are, and no matter how we present ourselves to other people. I don't think we always share who we really are with other people. And because so many people don't share what's really going on inside of them, everybody else is left thinking, oh, what's going on inside of me is worse than what everyone else is dealing with. So that's sort of the first thing that comes to mind. And then the second thing that pops into my head is how we choose to frame things, how we talk to ourselves and what we say to ourselves. And I'll give you a perfect example. You know that I had detached retina and just had retina surgery, which was in the hospital 2 days before Christmas, and then they put a gas bubble in my eye. And I've spent the last 2 months not being able to see out of one of my eye, and the gas bubble slowly dissipates and my vision comes back. Maybe not as perfectly as it was before the detachment, but it's coming back gradually. And I had my 2 month checkup this morning, and they tested my eye, and then we went in and I was talking to the doctor, and he goes, "Oh, you're doing really good." And I said, "Yeah, the eye that was affected isn't that good." And he goes, "Are you kidding?" He goes, "I think the eye that we just dealt with is doing great." And so he said, "You've got to be positive, Paul." And I'm thinking, that's what I talk about all the time, is being positive. And so this reframing is so important. And I think the easiest way to understand that is for us to understand that how our reality is really based upon what we tell ourselves. We're creating our own realities by what we tell ourselves. So if it's 90 degrees out and we say it's really hot, then and I'm miserable, then you're really hot and you're miserable. That's the reality. If it's 90 degrees and you look at that and you go, oh, it's a beautiful day, it's snowing up north and we get to go outside in our t-shirts, then it's a t-shirt kind of day. And so both of those things are reality. And at the very base, or at the very core of that, it's 90 degrees. And then it's what we do with that fact. And so when we tell ourselves, I'll never meet anybody, my life has changed in such a dramatic way, I'm going to be lonely for the rest of my life. These stories that we tell ourselves are actually what we're doing is we are creating our reality. And so then what we tell ourselves becomes our reality. This morning, I started going back to the gym because I have neuropathy in my legs. And I need to strengthen my muscles in my legs. And so I wake up in the morning and I go, oh, I've got to go to the gym this morning. And then I think, wait a minute, I can reframe that. And I can say, I get to go to the gym this morning and begin to strengthen my legs. One of those things is like, oh, it's like, it's really more debilitating than my neuropathy. And yet the other way of framing that creates a sense of hope and empowerment. And then it changes my mood. I'm lucky enough to be able to go to a gym. And so just those subtle little things, I met a guy at the gym a couple of years ago, and he said to me, I said, how you doing, Jim? Joe, I think his name was. And he goes, oh, Mondays suck. And so I thought, oh my God, that's, it's like, I went back to my office and I told my friend, this guy at the gym said Mondays suck. And we did the math. And that turned out to be 10 years of his life sucked just because he chose to create this make-believe reality that Mondays suck. Mondays don't suck. Mondays are just Mondays. So what you tell yourself about Monday creates the reality of what your Mondays are going to be like. So, to get back to your question, I would just ask people to begin, because I'm a great believer in not sugarcoating things and not pretending things aren't really challenging, because life is challenging. And if we all laid our lives out on the table for other people to see, we would see that we may have different challenges, but most of us have challenges at different times in our lives. But if we begin to be open to the possibility of rethinking how we talk to ourselves, then we begin to open ourselves up to other opportunities. That was a long answer to a short question.
Oh, but I think that that's a brilliant answer, because that's exactly what, happens. I love the concept that everybody goes through changes. It doesn't matter, if there's a neuromuscular disease or not. And some people have to accept the changes that happen a little faster. They may have more weakness than other people. They may be in a wheelchair that's a different change than other people. But yet, then once those changes do occur, what you're saying is that the way we frame and tell the story in our mind is really crucial. For example, like you said, you're able to go to the gym, or you even say, look, what about the results? How will I feel after? I will feel great. And so there is that motivation to do it. And there's also how we think about things that's very important. And just being very grateful for every little piece of it. And so if reframing everything is it's just a brilliant concept. And I think if we can reframe things, like we have patients who are scared to meet people, or scared that they'll never ever have a relationship, but yet if they reframe it and say, hey, look, I'm happy that I'm out here and I've got the chance to meet somebody, or I've got the chance to talk to somebody on the phone or connect on the computer, and then they can move forward with that. And that brings me to the second question I have. And I love this book, eh, Getting to Yes, right? Or Beginning with Yes, right?
Begin with yes.
Begin with yes. And I love this book because it's so informative. It's really a nice read. You can get that done quickly, but it really impacts one's life, because if you just begin something, and that's what I wanted to figure out. Our patients too, like if they have, whether they have a wheelchair or they have a disability or they have weakness, if that there's some concept in that really can take home and bring to their lives, which is that book offers. And I wanted you to help bring that to life for these patients. What could they do? What could they use from that book? I mean, I think that there's so too many examples to say, but that book could really transform a lot of people. So what are your thoughts about that, and using those tools?
Yeah, I mean, one thing I can tell you, and I frequently do podcasts and speak to groups of people and do private coaching or mentoring, and it feels like so many people feel just stuck. And when I first wrote the book Beginning with Yes, I thought yes, because I'm a positive person mostly, that yes was the powerful word. But the really powerful word is to begin. and to do something and to, one of my favorite questions is now what, which moves you out of saying, focusing on what's not working the way you want to in your life. But when you ask yourself, now what? It turns a switch on that gets you more action oriented. And when you begin to take an action, you know what? You can't be doing something and stuck at the same time. It's absolutely impossible. And by small steps, I'd love to think of, like, let's go back to that social, I'll never meet anybody, or I'll be lonely for the rest of my life, or no one's going to want me. If you stop just sort of, telling yourself that and ask yourself, what could I do to be a little less lonely? Or what might I do to find somebody that I could talk to about how I'm really feeling? Just those really simple questions, and then begin to take very small steps. The concept of small steps is not anything I imagined. There have been literally probably hundreds of books that talk about these small steps. And if you think of the sort of overwhelming nature of what you're trying to solve, then you get really stuck. You become overwhelmed. But if you think about, what's one small thing I can move me in a direction that I want to go, just one small thing, and so small that you can do it in 15 minutes or 10 minutes or 5 minutes. Even if you take that one small step, you're not stuck anymore. You are moving. I tell people, a lot of people tell me, and you're going to have a hard time getting me to shut up, but a lot of people say,
Oh, I have
oh,
so many stories. Yeah.
no,
What did they
people,
say? Yeah.
so many people tell me, oh, I want to write a book.
Yeah.
And so I say, write a sentence, because as soon as you've written a sentence, then you are writing a book. And then you start telling yourself, not, I want to write a book. You start saying, because it's true, I am writing a book. And if you are writing a book and you write one sentence, then maybe the next day you'll have the first paragraph.
I
And so it's like that with almost all of the situations that we're trying to deal with.
So let's take the patient in a wheelchair. What's the
Yeah.
first step she could take to meet people? I mean, what's the one small thing she could do? She said she wants to meet people and be friendly, but she's scared. She's scared of the gym. She's scared of what other people will say to her. So
Right.
what's one small step for her? She could.
I can give you an example that pops into my mind, but what I really love to do is make people discover their own first steps. Because if I discover it for you, then it doesn't have as much power. So given that, I will give you an example just as a
Yes,
way
that
of
sounds great.
teaching people how to do it. So
Sure.
one thing people who are listening to this could do is, at the beginning of our conversation, I told them about a Facebook page called Begin with Yes, where there's a million people all dealing with all different kinds of problems from all different countries in the world. And every day, thousands of people go there and talk to each other. So one small thing anybody that has a computer and that's on Facebook could do is go to the Begin with Yes page and begin to engage. So the reality is, then you have the potential of making friends from all over the world by simply going on the computer and looking for Begin with Yes. That's just one small thing.
That's
But I would
awesome.
really, like, anybody that's saying that wants me to come up with a small thing, I would say, you come up with a small thing, because what's one small thing you could do?
Let me give you an example then. So in
Okay.
our clinic just last week we had a patient. And he told me, he said, he didn't want to live anymore. He wanted to kill himself because his wife had left him 14 years ago. And he was just not able to get over that depression and the
Right.
sadness that he faced from the fact that his wife betrayed him. And he
Right.
still loved her very, very much. And I said to him, I said, look, I promise. I said, can you smile? He's like, no way. Am I going to smile? I said, look, I promise you, when you get out of here, we'll try to see if you can smile and change your perspective. So, the first thing we did was we kind of reframe, like you said, everything. I said, do you want to choose thinking happy thoughts or thinking sad thoughts? And he, of course, said a happy thought. So we came up with a happy memory. And so he became, a little bit more jovial. And then what happened after that was I said, let's go ahead and see what you want to do, something fun that you enjoy. Do you like dancing? And he said, oh, I love dancing. I said, do you want to try? He doesn't know how. So what I did was I put a YouTube video of line dancing on my computer. And I said, would you care to join me in learning this? I don't know how to line dance. And he said, no, I absolutely don't want to do this. I'm scared. And I said, that's when I came and used your book. I used exactly what you teach, one small step. I said, take one small step with
literally,
me.
right?
Yes, I did. I absolutely said this. And I said, take one small step with me and dance with me. And he said, sure. And as he started dancing, he didn't want to stop dancing. He had so much fun. And I think that really transformed his. He said, now I want to go line dancing every week. And I'm going to learn and I'm going to be so excited and joyful. And I said, yes. And this one small step made a big difference. And it was actually a literal and figurative step, right? Like he just took a step on the dance floor, but he's also doing it figuratively. He took one more step, right? In his life to move forward from the pain of the past. And he had told these stories that he couldn't do it. He had kind of screened and shut down his ability to enjoy life. And then once it became dancing, then he started talking about food and restaurants and living and something that was endless. We were starting to enjoy. So really, it's important to take and refocus and use. Your book is brilliant, and it seems like it's a small concept, simple concept, but that simplicity in it is just fabulous. It takes people to the next level, right?
The other thing, right. And I know we're probably running out of time, but the other thing another thing that I have found helpful for people with all different kinds of feelings is that if you're lonely, find somebody else who's lonely and cheer them up. If you're scared, help somebody else be brave. And if you can sort of identify what's going on in you and then look to help somebody else who's got the similar kind of, and help them, all of a sudden your life changes. It's hard to describe, but I see it happening over and over again. And the other thing is if you're not going to go, if you're walking from Orlando to Washington, D.C., one step at a time, you're not going to get there with 2 or 3 steps. So you've got to recognize that this is a journey. This is a process. This takes some time. But you know what? Once we decide we're going to move, we're going to take that first step, then we're moving and we begin to feel better. And the better we feel, the easier the next step gets.
That sounds great. So thank you. I appreciate it. You have done a lot for everyone. And with 2 million Facebook followers, and of course now you can add me. So I've got one more. I know you have one more. I don't think that makes any difference. But
it does. Every single person makes a difference. I'll tell you that.
And then you'll have all our patients. But you make so many things happen for patients, and I look forward to continuing this discussion as more and more issues come up. Our patients have more and more questions, and we also can work with different groups out there that have different needs, because not every patient is the same.